Hello. Today the topic is Aspergillosis. In textbook like Davidson, the topic Aspergillosis is described very well and elaborately and completely, but a little bit of haphazardly. There is no good categorization, and as because there is no good classification or categorization in Davidson, it is very difficult to memorize, I think, at least for me. And so from the internet I collect this tabulated or classification. After inhalation of Aspergillus spore, what happens? The spore of course enter inside the respiratory tract, and if the host is normal, that is immunocompetent, no sequel or nothing happen when the patient is immunocompetent. Nothing. When the Aspergillus spore enter the lung having a cavitary lesion, that means the patient already have a cavitary lesion inside the lung due to any disease process like tuberculosis or any trauma or any bronchial lesion. Anything due to anything else, that is cavitary lesion. It may be due to tuberculosis or lung abscess or anything else. So in the cavitary lung lesion, the Aspergillus spore germinate and form a ball, and that is called aspergillioma. From our pathology knowledge, we know the oma means tumor, but here this oma signify no tumor, rather aspergilloma means a ball or fungal ball inside a already formed cavity in the lung. When the Aspergillus spore enter the patient having a chronic lung disease like mild to moderate chronic obstructive pulmonary disease, lung fibrosis or bronchiectasis, then the spectrum of formation what the Aspergillus take is chronic necrotizing aspergillosis, CNA. This chronic necrotizing aspergillosis, also known as subacute invasive pulmonary aspergillosis, IPA. When the aspergillus enter the lung of a patient with immunocompromised state, ICH, that means immunocompromised host. When the aspergillosis occurs in immunocompromised host, the form of aspergillosis is called IPA, invasive pulmonary aspergillosis. I repeat again, invasive pulmonary aspergillosis. And when the aspergillosis occurs in immunocompetent but patient having chronic lung disease like bronchiectasis, the form of aspergillosis is called subacute invasive pulmonary aspergillosis. Previously this is called CNA, chronic necrotizing aspergillosis. Now the question is, who are immunocompromised host? The immunocompromised host in the Davidson, those who are with neutropenia, importantly the neutrophil count less than 500. The patient with organ transplantation, even bone marrow transplantation, patient with long-term steroid therapy, patient with cytotoxic chemotherapy, and patient with advanced HIV disease, patient with severe chronic obstructive lung disease. Mind it, patient with severe obstructive lung disease, they are immunocompromised host, but patient with mild to moderate chronic obstructive lung disease, they are not actually chronic immunocompromised host. They are categorized here in the number 3, patient having chronic lung disease. The patient with chronic granulomatous disease and patient with who are treated in the intensive care unit, they are also immunocompromised. So the immunocompromised host with Aspergillus spore inside their lung develop invasive pulmonary aspergillosis. They are invasive because the Aspergillus spore invade or spread in the systematic circulation, and they may involve the other organ, any other organ like brain, kidney, heart, adrenal gland, and any other organ. So very life-threatening condition, the IPA. Number 5, when the Aspergillus spore enter the patient who are already asthmatic, the diagnosed case of asthma. The spectrum what the Aspergillus take is called ABPA, allergic bronchopulmonary aspergillosis. So these 1, 2, 3, 4, 5, actually 4 spectrum: aspergilloma, chronic necrotizing aspergillosis, invasive pulmonary aspergillosis, and ABPA sorry, allergic bronchopulmonary aspergillosis. In our exam, actually the topic from aspergillosis is 2, aspergilloma and ABPA. Mind it, aspergilloma means aspergillosis in a patient having previous cavitary lung disease, and ABPA means the aspergilloma in patient with asthma. Very easy. And IPA, invasive pulmonary aspergillosis, means the aspergillosis in a patient with immunocompromised host. And CNA, that is chronic necrotizing aspergillosis, means the aspergillosis in a patient with chronic lung disease like tuberculosis, bronchiectasis, restrictive lung disease, or mild to moderate chronic obstructive lung disease. Okay. Now, very simply, the aspergilloma in CT scan or HRCT or even chest X-ray, the aspergilloma is seen in a ball within a cavity. Aspergilloma, a fungal aspergilloma, a fungal ball inside a cavity. So this is a cavity. Say this is a cavity in the lung parenchyma. Inside this cavity, a fungal ball like this. This is the fungal ball, and above the fungal ball, this area, crescent area, in the CT scan or X-ray, this green area appear as black, and this area appear as white. Okay, so this area appear as black or radio lucent, and this area appear as white, that means radio opaque. Okay, so this above black area above the fungal ball is called crescent air sign. Crescent air sign. Now the point is, sometimes, not always, inside the cavity, previously formed cavity in the lung parenchyma, the fungal ball may be found just center to the cavity. This is the fungal ball, and around the fungal ball, there is a air shadow. All around the fungal ball, air shadow. Sometimes it is seen. So something different, at least radiologically, and this is called monod sign. Monod, M-O-N-O-D, monod sign. Wrongly spelled, it is the monad. Not A, mind it, not A. This is wrong spelling. This is good, correct spelling. Monad, M-O-N-O-D, monad sign. So, crescent sign and monad sign actually signify the same thing, but differently. In crescent sign, there is a fungal ball, and above the fungal ball there is a crescent air shadow. And in monad sign, the fungal ball inside the cavity and the air shadow around the ball, nothing else. Okay, so this is all about aspergillosis. Thank you very much.